The world is a global village.
And that's because information travels beyond boundaries.
And on This Morning on ITV,
we guarantee unbiased analysis on topical issues
that will educate you,
entertain you.
So join us.
Join us.
Join us.
Join us.
Join us.
Join us.
Every Sunday to Thursday, 7 a.m. to 10 a.m. on your ultimate news and current affairs program on television, This Morning on ITV TMR. Join us.
Thank you for joining me on This Morning on ITV, and this very topic we'll be looking at as first discussion will be on the monkeypox outbreak in Nigeria, which reports have it that has been spreading even in 7 states as we speak. And quickly discussing this vital topic with me, I have Dr. Paul Okoje, a consultant, community medicine physician and lecturer, head Department of Community Medicine, Igbinedion University, Okada. Thank you for coming, Dr. Paul Okoje.
Thank you for having me, Philip.
All right, again, before we commence in earnest, we like to advise that viewers' discretion is needed because some of the images that will be propping up on the images of the victims of the monkeypox virus could be very, very unpleasant to the eyes. Please, viewers' discretion is advised. Well, Dr. Paul, let's look at the monkeypox virus because looking at it, we have monkeypox. And as it's being named, the impression is that it's sourced from monkey. But before you give us the source of this virus, what is monkeypox?
Well, thank you for having me once more. Monkeypox is a viral disease. It's zoonotic viral disease. What that means is that a disease that is transmitted to humans from animals. The name monkeypox came about when in 1958 in Copenhagen in Denmark, you had experimental animals, that's monkeys, and what is now known as monkeypox was so named because in that laboratory in Denmark, you had this is called the State Serum Institute. So you had this outbreak of this disease in these animals. So that's where that name came from. But the first human case of monkeypox was identified in Democratic Republic of Congo in the year 1970. And ever since you had different epidemics. This particular epidemic that we are grappling with right now should be the 3rd one in the history of Nigeria. The first one being in 1971, then in 1978. Between 1971 and 1978, there were 3 human cases. The thing about this disease is that while it is endemic in Central Africa, Democratic Republic of Congo to be precise, the Congo Basin, you also have it in West Africa. These are the 2 main parts of Africa where you have the monkeypox. But we must also stress that we've had most epidemics of monkeypox in Democratic Republic of Congo.
Okay, you may mention the fact that we've had a history of this virus and we're able to tackle it. Can you tell us what measures were deployed to ensure that it was tackled in the past?
Yes, I can't really be very specific concerning what measures were deployed because then we depended on foreigners to help us even determine what the disease was. The history I gave you concerning those first 3 human cases that occurred between 1971 and 1978 is credited to the United States Centers for Disease Control. But there have been other reported cases in Central Republic of Congo, DRC, as well as even cases exported to outside of the African continent, specifically the United States of America. That was in the year 2003. You had this group of animals exported from Africa to the United States. And some of these animals were in-housed with some prairie dogs. And these dogs eventually had contact with humans, and that was how the first case of monkeypox was recorded in the United States in 2003.
Okay.
So, but primarily it has been a disease that has been resident in Africa.
Okay, one should also expect that since we've had this history in Nigeria, there should be facilities, laboratories in the country to diagnose this.
Well, shamefully and unfortunately, you cannot laboratory confirm the existence of monkeypox without foreign support. Clinically, yes, you can diagnose monkeypox, but you need laboratory support to be able to definitely say that this is monkeypox that you are dealing with. For now, you can only confirm monkeypox in a laboratory by sending samples to overseas. When I say overseas, Senegal.
Senegal.
Exactly.
Okay, but is it a challenge of training that could be lacking in terms of the Nigerian teaching hospitals? Or is it a challenge of equipment?
All right, this really has nothing to do with a challenge of training, because if you talk about human capacity and scholarship, you cannot beat Nigerians. But this is more of a matter of political will.
Political will?
Yes, more of political will and the desire to effectively set up infrastructure, you know, that will make us be able to respond 100%, both at the clinical level and at the laboratory level when you have an epidemic of this sort. So that is it. To maintain a laboratory of this grade that will help you say definitely that this is what you're dealing with, you need other things to support it. I'll give you an example. There are laboratories you cannot manage without having constant power supply. So you don't joke with your samples.
Yes.
Do you get it? So there are basic things that we have failed to put in place to help support. It's a system thing. So it's not really about human capacity. If you leave this country, you'll see that Nigerians do wonders. So it has nothing to do with human capacity. I think it's just failure of those whose responsibility it is primarily to put these things in place that have failed to do so. Because before now, in the 70s, you had a lot of these diseases being laboratory confirmed in this country in laboratories in Nigeria. So what has happened over the years is that we have allowed our own systems to decay, and this is where we have found ourselves. We shouldn't be running to Senegal to confirm a viral infection. We should be able to do that in Nigeria.
You made mention of the word lack of political will on the part of the leadership of the country. Looking at that as it is, why we look at the fatality rate, because there's this fear. It was generated, it caused a chaos, pandemonium in some states when they noticed that there was an immunization going on, which was a false report, and a lot of persons went to schools picking their children. Now, if we say that we have this challenge of not even having the right equipment, the right laboratory, right facility to diagnose this, what is the hope that this ailment can be tackled?
All right, without causing a scare, the good thing about, good in quotes, about monkeypox viral disease is that it is self-limiting. What that means is that you may survive it. You're likely to survive it.
Likely?
Yes, even if you don't have access to formal organized health system, okay, which is not to be neglected anyway. So it's not really a very deadly condition.
But it kills.
It does. It does, particularly in children.
And it's highly contagious.
It is contagious, but it is not a disease that really kills like that.
Okay.
We've had 31 cases or thereabouts in Nigeria since the outbreak on the 22nd of September this year, but no fatality has been recorded.
Okay.
In fact, from what is known from experience from previous epidemic, fatality ranges from between 1 to 10%, which is quite minimal, I would say. And if you compare monkeypox to other pox disease like smallpox, monkeypox, the symptoms are even milder. Yeah, it's a mild disease more or less.
Okay, what are the symptoms one should watch out for?
Basically, you have fever, intense headache, muscle pain, joint pains, generalized body pains, as well as you have skin lesions as well.
Okay, but these symptoms is not far from other ailment symptoms.
Exactly, exactly, you are right, because this is a disease that mimics some other diseases that present with skin lesions as well as fever, joint pains and like that. But you see, there is always something distinct and characteristic about every viral illness. And for monkeypox, the fact that you have, first of all, let us establish the fact that you have fever, and characteristically within 3 days of onset of fever, you have rashes coming out, okay? And this is with the presence of other symptoms that I've outlined earlier. Then there is something peculiar about the kind of rash that you have with monkeypox. They are kind of bigger compared to the other rashes you have, maybe in measles or smallpox that has been eradicated, or even chickenpox that is popular. And these rashes can even develop on the palm, even the sole of the feet, the eyeball, as well as the eyelid. The major difference, talking about rash now, the major difference between monkeypox and these other pox virus is that you also have the swelling of the lymph glands, the lymph nodes. And these lymph nodes are distributed in the head and neck, the upper limb, the trunk, as well as the lower limbs. These lymph glands are there to help with immunity and also to help exchange of waste materials between the blood system and the body tissues. So this is what makes it distinct, you know, talking about the rash now clinically from other pox virus infections. Okay,
there's this normal hygiene consciousness that we keep telling people to ensure that they avoid bodily contact with those who carry this virus. But you made mention of these various symptoms. One may not be able to quickly locate a rash when it starts on someone. So how do we avoid?
All right, the truth is if you see someone with monkeypox, it's very easy to know, because in 95% of cases you have this big looking rashes distributed all over the face.
But does it just develop that at the instance?
It doesn't start at the instant. Like I said, within 3 to 4 days of developing fever and headache, these rashes start to come up. So
at that point when the rash is not up, can't it be contracted?
Of course it can.
That's the danger.
Of course it can. But the point is this: you only can contract this disease by the time you come in contact with an individual who has these rashes and the body fluids, secretions from these rashes. That is when you are actually likely, most likely, that is when this person becomes infectious.
Like in buses, for instance, where passengers will have to compact themselves in the bus.
I'll tell you something. If there is an outbreak of monkeypox, you are not likely to find a situation, take it from me, you are not likely to find a situation where a patient that is that ill and presenting with those obvious symptoms will be in a bus with anybody. I can assure you of that. Because people will get scared.
Let's look at the aspect of vaccines. Like children are mostly immunized against smallpox. At that level of vaccination, can it have a relative resistance?
All right, let me just first of all let the public know that smallpox vaccination more or less has been halted because smallpox was eradicated in 1980. The last case of smallpox was reported in Somalia in 1979. But the good thing about those who were fortunate to get vaccinated for smallpox is that they have 85% protection
All right.
against
This
chickenpox.
Okay.
Monkeypox virus. So, but now that you don't have smallpox vaccines readily available, except where they've been kept in protection in laboratories around the world, few laboratories, to prevent it from being weaponized and all that, you discover that anyone who has this disease right now, smallpox right now, smallpox has been eradicated, so we're not talking about smallpox, who has a monkeypox, will not have access to the smallpox vaccine. So the symptoms in that regard are likely to be a little bit more severe. So there's no vaccine for monkeypox.
No vaccine.
There's no vaccine for monkeypox.
So which means there's no cure.
There is no known cure for monkeypox.
It's known for now.
Exactly. So when patients or individuals come down with signs and symptoms of monkeypox, what usually happens is that they are being supportively managed. Those symptoms I talked about, so pain relief, rehydration, the use of antibiotics, bed rest and all that, good nutrition to help build their health status and build their immune system. So that's what happens.
Okay, well, I've been having a chat with Dr. Paul West Okoje. He is a consultant community medicine physician and also a lecturer, head Department of Community Medicine at Igbenito University, Okada. Well, as we round off on this segment, Dr. Paul, what are the precautions, hygiene consciousness that one should maintain in avoiding this?
Yes, first of all, for those who make contact with animals, I have to be specific, squirrels, rats, rodents generally, including monkeys, you have to be careful. If you kill those animals for meat or something, you have to cook them very well, you have to wash them very well, and you also have to wash your hands very well. That is between those who handle those animals.
Okay.
Then for those who lead animals about, there also has to be restriction. I am aware that there are international regulations, and sometimes countries enforce laws and regulations that control the movement of animals about. For example, it will be foolhardy, for example, for us to be importing monkeys from DRC. When we know that it's possible to. Do you get it? So these are some of the things.
Okay, you just cautioned that if at all one has to take meat of that sort, it should be properly cooked. But there's this advice also that we should avoid bushmeats.
People have a right to eat meat. We cannot take their rights from them. But if you must eat bushmeat, you have to cook it properly. I cannot tell people not to take delight in what they are interested in.
Okay, what about those who have pets? What's the level of exposure? How can it be prevented?
It's not all pets, so we have to be specific. If you have monkeys as pets, or you lead monkeys about, you have to be careful by the time these monkeys present with these same symptoms, because they present in those same monkeys just the way they do in humans. Then the simplest thing that you can do that will not cost you anything, very cost effective but highly effective, is hand washing.
Hand washing. And hand sanitizers also?
Even if you are not going that far, just soap and water will do it for you.
We mustn't avoid handshakes?
No.
I just had a handshake with you.
Yes, then for medical workers, they also have to observe the highest level of infection control measures.
Okay, thank you very much, Dr. Paul West Okoje. Well, this is where we draw a close on this segment.
This is ITV. Certainly the best.